In this video we're going to talk about recurrent urinary tract infections, and we'll discuss about the management and how we can prevent the recurrent infections. I often get asked if cranberry juice has any effect in preventing urinary infection. You will find out the answer to this question, as well as the best way to manage this urinary condition in this video. Recurrent urinary tract infections are defined as more than 3 episodes of documented infection of the urinary tract in over a year, or more than 2 episodes over a 6-month period. It is important to follow this way of classifying this condition, as well as having urinary infections documented with urine culture before we consider this diagnosis. Recurrent urinary tract infections are common, and they do have called risk factors, which can be split into 2 large groups. The first group is for young premenopausal women, and the risk factors for this category will include sexual intercourse, a new sexual partner, use of spermicides, as well as a mother with a history of urinary tract infection, or a personal medical history or for urinary tract infections in their childhood. For postmenopausal and elderly women, the risk factors consist in inability to empty the bladder properly, or a large post-void residual, as it is also called, a history of urinary tract infections, premenopausal, atrophic vaginitis. Another risk factor is caused by urinary catheterization, especially in elderly population. Another risk factors are urine incontinence and vaginal prolapse, such as cystocele. Diagnosis should be confirmed by urine culture. In the following minutes we are going to talk about disease management and how can we prevent reoccurrence of urinary tract infections. Management of this condition should be done in a stepwise fashion, started with behavioral measures, followed by non-antimicrobial prophylactic measures, and if all of these have failed, antimicrobial prophylaxis. There are many behavioral measures that have been related to potentially causing urinary tract infections, such as delayed habitual or postcoital micturition, a reduced fluid intake, or wiping from back to front after defecation, as well as wearing occlusive underwear. None of these have been proven in scientific trials to be correlated with the risk of recurrent urinary tract infections. But as they can be easily implemented, they are the first line of our fight against the recurrent infections. If these measures has failed, we can proceed with non-antimicrobial measures, and one of these is to diagnose atrophic vaginitis, especially in postmenopausal woman, and there is evidence that if this is treated with vaginal estrogen replacement therapy, but not with oral estrogens, it can reduce the number of recurrent infections, so it is important to diagnose and treat this condition. Another way to prevent recurrent urinary tract infections is Urovaxom, or so-called OM89, which has been proven in randomized controlled trials to reduce the number of recurrent urinary tract infections in a fashion better than a placebo, so it can be recommended in the female population. For other risk groups, it has to be proven, and till further studies are done, it is not recommended. Prophylaxis with probiotics such as Lactobacillus have been recently investigated in meta-analyses, and reviewing all of these trials and analyzing the data did not find any benefit from this way of trying to prevent infections compared to placebo, so it is not recommended. Having said so, it may be that there is a variability between the different products, and this variability between products might need to be further investigated, as some of them might have some benefits. Till further studies are done, they cannot be recommended. What about cranberry tablets? Even if some low powered studies have identified a potential benefit for cranberry products, a recent meta-analysis, 24 trials, has failed to prove any benefits in reducing the number of symptomatic urinary tract infections in female population. So because of the contradictory data, daily consumption of cranberry products for the prevention of urinary tract infection cannot be recommended. What about D-mannose? In a recent randomized placebo-controlled non-blinded clinical trial, meaning that the patient was aware if the treatment was with D-mannose or not, it has showed benefits in a dose of 2 grams of D-mannose per day, which was superior to placebo and similar to a dose of 50 milligrams of nitrofurantoin. But considering this evidence, we can only state that further trials are needed to be able to recommend it widely, and it can only be considered in clinical trials. Other ways of trying to prevent infections consist in endovesical instillations with hyaluronic acid or chondroitin sulfate. These have been used for a multitude of bladder conditions, and again, a meta-analysis has failed to prove any benefit, and the conclusion was that larger, better designed clinical trials are needed before any clinical recommendations can be made. After the behavioral measures and this non-antimicrobial prophylactic measures have failed, we can consider antimicrobial prophylaxis, and this can be done in 2 ways. One will be a daily dose of a low dose of antimicrobial. Another way of doing it would be to use post-coital prophylaxis. Both options should be discussed and agreed with the patient, and examples of low-dose antimicrobial prophylaxis can consist in either nitrofurantoin or fosfomycin, or during pregnancy with cefalexin. Another, maybe the best way of managing this condition would be with self-diagnosis in and self-treatment. This will require a very well informed and cooperative patient that understands the symptoms, understands the condition, and is able to self-administer the medication in the same usual dose as the ones recommended for an acute episode of urinary tract infection. I hope this has clarified the way we can safely and evidence-based try to control recurrent urinary tract infections. For more information about medical conditions, please subscribe to our channel.